Hi, I'm Zoe Biggs. This presentation will discuss and analyse ethical considerations in relation to a case study involving paramedic care. The case study I will be using for this presentation is multiple patient overdose. The case study was published by Townsend and Luck in 2013. Townsend and Luck define ethics as the study of what it means for something to be morally right or wrong. Berglund defined ethics as ways of understanding and examining the moral life. He further explained that ethics helps you to decide what to do in routine and complex or difficult situations. It acts as a guide and a reasoned voice. Common ethical issues faced by paramedics include informed consent, competence, not beginning or continuing life-sustaining treatments, duty to provide care, and confidentiality. Informed consent can be difficult in emergency situations, as the patient may not be able to consent to the treatment due to their injuries and/or conscious state. Competence is judged by the paramedic by assessing a number of factors to ensure the patient is able to make the decision for themselves. This can cause a number of ethical dilemmas, as the paramedic may not correctly identify their competency. Paramedics are often faced with dilemmas as to whether advanced care directives or other legal documentation exists, which affects the treatment they can provide to a patient. In potentially dangerous situations, paramedics often have the ethical dilemma of whether they should follow their duty to provide care or ensure their own safety. Paramedics have a responsibility to be confidential with the patient's information, although they are required to provide information to other healthcare workers and sometimes the media. When providing information to others, paramedics must ensure information is de-identified to provide the patient with confidentiality. Paramedics in Australia have a number of codes of conduct relating to both state and national levels. For the purpose of this assignment, I will discuss the Paramedics Australasia Code of Conduct, as it is the most universal. The Code of Conduct addresses integrity, respect, responsibility, accountability, competency, consent for patient care, confidentiality, research, and ethical review. These ideals create an ethical standpoint for paramedics to make decisions in ethically demanding situations. Integrity relates to paramedics' honesty, sincerity, and trustworthiness. Respect relates to ensuring actions and treatment is respectful towards the patient and that a high standard of care is provided. Professional decisions must be responsible and the paramedic must be accountable. Competence relates to professional development and ensuring skills and knowledge are maintained and improved. Paramedics must ensure patients always provide informed consent for treatment. Confidentiality of patients must always be maintained. Research relates to the promotion, support, and involvement in pre-hospital research. Ethical review ensures all paramedics review actions, care, and conduct when practicing emergency medicine. The Code of Conduct creates principles for paramedics to use when making ethical decisions. It is important to note that some of the principles within the Code of Conduct are not directly related to ethics, but rather provide paramedics with a set of values. The case study, Multiple Patient Overdose, describes a scenario where a paramedic is called to a party where 4 people are unconscious due to overdose. The patients are in respiratory depression, which indicates the severity of the overdose. The paramedic only carries 2 doses of the drug used to reverse the overdose. A backup crew may not arrive in time due to the high demand as a result of a public holiday. The ethical concern in this case study is the decision to give 4 people half a dose of the drug, which may not reverse the respiratory depression, or 2 people the full dose, knowing that would save 2 lives but risk the other 2 passing away. The parties involved include paramedics, the ambulance service, and the patients. Ethical theories include consequential ethics, deontological ethics, and virtue ethics. Consequential ethics, sometimes referred to as utilitarianism or teleological ethics, relates to the belief that you should do what is likely to lead to the best possible consequences. This is measured by the amount of happiness caused as a result of the consequence of the action. Deontological ethics, known as Kantianism, duty theory, or rights-based ethics, is an action that is guided by universal moral rules. Virtue ethics is an action that is guided by a person's virtue. Virtues are character or personality traits that demonstrate a complex and moral state of mind. The principles of ethics, non-maleficence, beneficence, and justice relate directly to the case study. Non-maleficence is ensuring you do not harm your patient through actions or lack of actions. Non-maleficence is important in this case study as it enforces that something needs to be done to not harm the patient through lack of actions. In this case study, lack of actions is likely to cause more harm than actions, reiterating the importance of deciding a course of action. Beneficence is ensuring you help all patients. This is difficult in the scenario as the paramedic only has 2 doses of the reversal drug available, but perhaps other interventions should be used to help all patients and ensure all ethical principles are followed. Justice is ensuring patients are treated fairly and equally according to their needs. This is very important in the case study as it demonstrates the need to treat patients equally, which means all 4 patients should get the drug, theoretically. All of these theories could be applied to the case study depending on the person, organisation, and situation. The ethical theory that would work best for this case, in my opinion, is consequential ethics. This is because it provides the clearest solution to the ethical dilemma. As consequential ethics is about ensuring the most happiness, this theory helps paramedics decide what action to take. Using the consequential ethics theory, the paramedic would give the 2 doses to 2 patients, as this will result in the most happiness, as 2 people will survive. Although this theory does provide us with an answer to the dilemma, the ethical principles discussed earlier are not being met. But is there a way for this situation to be equal for all patients involved? I would argue no. In this situation, I would consider providing 2 people the reversal dose, as per the theory, then providing other interventions to other patients with the help of capable bystanders until another paramedic can bring more doses to the scene. By using this strategy, the principles of non-maleficence, beneficence, and justice are being addressed. The ethical issue was never resolved within the case study. For future ethical decision making in the field of paramedicine, I believe a clearer code of conduct, continued training in ethics, and support for making ethical decisions is required. The code of conduct should integrate the principles of ethics to ensure ethical decisions are made responsibly. The code of conduct discusses qualities and ambitions for paramedics rather than ethical stances. These qualities may be beneficial for those who use the virtue ethics model, but I believe a more structured ethical stance would be useful for those who do not use virtue ethics, especially as very few people reach true virtue ethical morals. Ongoing education on ethics and ethical principles for paramedics would be beneficial in improving ethical decisions made on road. The ethical decision-making model for paramedics pre-care is an example of a strategy to teach paramedics. Pre-care stands for problem, reconnaissance, ethics, code, alternative, regulations, and evaluate. This model provides a guide to make ethical decisions by following a step-by-step approach. By following this model, paramedics have a systematic approach to assessing and acting ethically in demanding situations. Support when making ethical decisions is essential in paramedicine. As it is emergency situations that paramedics respond to, there is little time to weigh up the correct response to ethical dilemmas. A support person to talk to about ethical decisions, much like the clinician support in Ambulance Victoria, will be beneficial to ensure decisions are made appropriately. The ability to talk through the situation, especially for a single crew officer, is an important part of working through a situation. Paramedics are faced with ethical decisions daily. The various codes of conduct, as well as training, help them to make appropriate decisions. Ethical theories and principles also create guidance to make decisions. Paramedics need further guidance in the code of conduct, training, and support when making decisions to ensure all decisions are made ethically. The case study has provided us with a real-life example of how important ethics is in paramedicine.